The broadcast is now starting. All attendees are in listen-only mode.
Good day. Happy Friday. Thank you for joining us for the Eurofins webinar, Solutions for Safer In-Person Meetings and Events Now. Today's webinar is hosted by Kelly Chaco. Kelly has been the Eurofins Director of Events since 2017, which includes managing operations and strategy for the U.S. Food Division and its nearly 40 laboratories. Each year, Kelly and her team manage over 120 national, regional, and local trade shows, as well as internal meetings, conferences, and customer-facing events. Kelly is a member of Meeting Professionals International and Society for Incentive Travel Excellence, serving on various committees, holding different positions, and receiving several awards. My name is Jessica Coco, and I'll be moderating today's webinar. Before the webinar begins, I do have a few housekeeping notes. The broadcast is being recorded, and you'll receive this recording as well as a copy of the slides via email within 3 business days following today's event. We'll end the presentation with a live Q&A session during which you can submit your questions to Kelly. In order to submit your questions, you can use the GoToWebinar sidebar menu, select the Questions tab, type in your question, and hit Enter. Please feel free to submit the questions throughout the webinar, and we'll follow up personally with any questions we're not able to get to during the Q&A session via email. And with that, Kelly, I'll go ahead and let you take it away.
Thank you, Jessica. Hello, everyone. We'll touch on safety measures utilized in these 3 case studies, along with others seen at various events. I've hosted events hosted by ALHI, North Star, and MPI in the last 6 weeks. You'll hear attendee feedback from the case studies in addition to the lessons learned and best practices for going forward. We'll end with reviewing the health monitoring protocol we utilized at the live events and allow time for some Q&A. We're all very aware of the impact the pandemic has had on the hospitality industry. The economic loss is predicted to be 10 times greater than that of 9/11, and unemployment twice the rate of the worst year during the Great Depression for the travel industry alone. The NPI Impact Sentiment Study revealed that when getting back to meeting in person, half of the people are expecting to see more on-site health monitoring. That is anyone who is planning, working, and/or attending meetings and events. On that note, let's take a quick polling question.
Great, thank you, Kelly. Before we move into the next section of the presentation, we'd like to learn a little bit more about the audience here, as well as our peers. So you should be seeing a poll question on your screen now. Go ahead and select all of the answers that apply for the following question, which is, if you are hosting in-person events currently, what types of on-site health monitoring do you offer? Again, select all that apply on the box to the left of those answers, which include temperature scanning, surface testing, PCR testing, rapid testing, or antibody testing. I'll leave this open for about 30 seconds or so, in which case we'll close and review those results.
Thank you, Justin. Just let me know when we're ready to see those results. Perfect.
Yes, so go ahead, Kelly. I don't know if you want to speak to these results, if this jives with what you've seen.
Can you share with me the percentages that are showing up on those poll results?
Yes, I'm sorry, I forget you can't see it. Rapid testing came in at the highest, followed by temperature scanning and then PCR testing.
Okay, interesting. Yes, and we will speak to rapid testing a bit more and the pros and cons of that a little bit later on. Temperature scanning, definitely, everyone's doing, or most people I've seen it at all the events that we've been to, are utilizing those temperature checks daily, which is a good practice. And the PCR testing is, I'm glad to hear people are already doing that, because to me, that is the gold standard in the industry. And we'll talk a little bit more later about why that is. So our first case study is an executive group that typically meets quarterly to review results, but they hadn't met in person since January. This meeting's goals was to review those results in a condensed format, but really the focus was on networking and getting people back together again with safety at top of mind. You can see the makeup of people who were there on the slide, and Madden's was the perfect property for the event. It was a 1,000-acre resort with abundant outdoor spaces for all of the networking, meal, team building, and meeting functions. The schedule is typical of many meetings with an arrival day, welcome dinner, team building, meeting component, farewell dinner, and departures over the course of 3 days. Check-in and check-out were similar, with the front desk and lobby mandating masks indoors, only allowing 2 households to come up at the time to the desk at a time, and using plexiglass separators between staff and guests. We advised everyone against carpooling, and we provided them with N95 masks when requested. For check-in, it was important to communicate to everyone the disinfection process for their room before they arrived and notify them there would be no housekeeping unless they specifically requested it. Checkout was encouraged to do by phone and drop the room keys in boxes located around the property. So we're referring to our welcome bag or amenity as a safety kit. So in ours, you can see it was an actual logoed bag with a mask, contact tracer, charger, name badge, reusable metal straw, and hand sanitizer per person. You could also consider making it an actual box like MPI did for WEC for those of you that registered there. I've listed some other items to the bottom right that could be used in a safety kit depending on what you think could be used, that would be best used by your attendees. And again, it factors in here. It's really good to know what's most important to your attendee group. So these are the safety standard protocols you'll see throughout each of the events during the week on site. For every meal, all of these shown were utilized: welcome dinner, group lunch, and farewell dinner. We held every function in an outdoor area. People wore their contact tracers to group events. We provided sanitizing stations and reminded everyone to socially distance and wear their masks when not actively eating or drinking. Limited seating was provided during the meals and meeting. All food and beverage was served at stations by masked and gloved attendants. There weren't any individual use items that could be grabbed. Everything like water, coffee, dessert, and silverware had to be provided by the attendant. Dining was done via timed table release to stagger queuing. And so no one table was getting their food at a time, and the flow was designed to start at one end, go down the line, and finish at the other to reduce people crossing by each other. So a quick question for the audience. Does everyone agree these are all standard and expected protocols in our current climate? Or was anyone surprised by anything on this list? I'll go back so you can see the items again. And Jess, if you can just let me know.
Great. Yeah, Kelly, it looks like the timetable release was an interesting note, as well as the dining flow there.
Excellent. Yes. So this comes down and comes back to when you're designing your event and you're looking at specifically where you're going to hold your meal functions, where the flow of the food is going to go. So the stations should be set up in a way that you're minimizing the number of times people will cross by one another, as well as the amount of time that they'll be in line next to each other. And you want to make sure that you only have a limited amount of people up at one time, so you can ensure that there's enough space to have 6 foot between each of them. So I've seen this at many different events and done in a variety of ways, but it's good to communicate before the dinner in part of the housekeeping notes how they're going to be going on flow. So which end they're starting at, which end that they're finishing at, and they'll start there and they'll be released one table at a time. Again, so you have minimal number of people standing up, and then you'll you'll kind of go through the whole line, and you'll have an attendant who's releasing those tables. So great, good to know that some of those were.
And one other one, Kelly,
Mm-hmm.
that I think is pretty common is the contact tracers. There's a note here that says, you know, we're not new with the concept, but we haven't actively seen them being used.
Excellent. Okay, yes. So if you, you know, there are many different organizations, industry organizations that are talking about contact tracers and Bluetooth trackers and how these are being utilized for events. So I will go into, I'll show you how we utilize them at some of the events, some of the other slides, as well as touch on why they're important, but not necessarily required. Again, it goes back to your budget, your attendees, what they're comfortable with, and what they're willing to do. Perfect. So with that, here are some pictures of the welcome dinner. Please note how the food and beverages are behind a table, separating the server and the guest. You know, in other places, especially indoors, different properties are utilizing plexiglass, which is a great benefit. So make sure that you're having those open conversations with your banquet teams and your CSMs at the hotel, if they have plexiglass already available, and if they don't, what they're willing to do in order to make to give that separation of space between staff and guest when serving food. Also notice the water and tea dispensers that must be handled by a staff member. You can see the way that they're positioned, so there's no single-use items that anyone can grab and serve themselves. So for the group lunch, you can see the stations continued and how we had an open air location of where people were eating. Activities and team building are an interesting piece of meetings now. The key is to make them optional to attend. Just like with meetings and in-person events in general, you always want to be making sure that those are optional. You're not forcing anyone to participate. So based on how comfortable the attendee is feeling, that's going to dictate whether they participate or not. So if you do offer activities as a means of team building, make sure you're doing the following: keeping them outdoors when possible, continuing to require masks when unable to socially distance, having additional mask and hand sanitizer available, limit seating in close proximity to one another. If you're providing food and beverage, have someone who is masked and gloved serve it. Take reservations online in advance when able. Eliminate as many touch points as possible for any activity. Have people use individual equipment and not share with one another. And if you are renting or sharing equipment, make sure to sanitize thoroughly between each use. So from the business meeting perspective, with outdoor AV, particularly with projection, it adds a layer of complexity. So one recommendation would be to make sure you have early discussions with your AV team exactly what you're trying to achieve. Will everyone in the space be able to join? Will they be joining from online? Or do those joining from home need to see the presenters in the space, or is audio sufficient? These are the types of questions that you'll need to have. So this space was an open air pavilion that had the screen in the most inner part for the best shading. And we did audio provided through the patch built into the speaker system. So now for PCR testing, I'm glad again some of you are familiar with this. We conducted on site in an open lawn area with 2 6-foot tables and 4 internal staff members. Markers were placed on the ground to keep anyone in line socially distanced. Release forms were collected and checked, and the registered nurse supervised the self-collection. I'm happy to say now with our FDA authorized EUA, which is Emergency Use Authorization, the PCR test is able to be self-collected without the supervision of a medical professional. The swabbing is now shallow and pain-free instead of the nasopharyngeal ones we've all heard about it and maybe even experienced at the beginning that felt like they were going into your brain. Now it's a regular size Q-tip you swab right in your nostrils in a very shallow way. And trust me, it's much better because I've done both. So another quick question. And you can put this in the chat box, but I'll pause briefly, but who knows the difference between PCR, antigen, and antibody testing? So when I refer to PCR testing, I'm talking about a molecular test that is the gold standard in the industry. So these tests look for the genetic blueprint or RNA of the virus. And for those of you who looking, again, for the differences, you can read them here. The difference, the two most common are definitely going to be the PCR and the antigen. So touching on those antigen tests that we, from earlier, they instead look for the virus capsid, so the shell and the capsule around the actual virus itself. So when a positive test is positive, it's highly accurate, and that's typical of your symptomatic people. But a negative test can be inconclusive, particularly with those that are asymptomatic. So we'll get into some solutions as well if you're going to go that route, how to make that more effective. Okay, so here are pictures of the final meal function, the farewell dinner. See that this time we did rolled and sanitized silverware that was at each place setting. So that can be an option as well. If you want to preset the table in any way, you can have waters already preset as long as they're covered, and you can do rolled sanitized silverware. Also see that the flow of this one was a bit different. So in here we had this kind of crescent shaped area to do the flow. So you started at one far end and you kind of made your way around the crescent shape and then walked back to your tables. And also this is where we had the contact tracers returned at the conclusion of the event. Okay, so keeping you guys on your toes, another polling question.
And this would be really interesting, Kelly. I'm curious to see the results here. But on your screen, again, you should see a poll question. And we'd like to know when your next in-person meeting is planned. The options here are 2020, first quarter of 2021, second quarter of 2021, or Q3 or later. And again, I'll leave that open for about 30 seconds or so, and then we can discuss those results. All right, I'll go ahead and show these results here in a second. But Kelly, I'm curious, when is your next in-person meeting planned?
Ours is actually planned for January, the end of January, and that's going to be about 100 to 120 people. And that's based on the current surveys that we've done, trying to gauge the sentiment of people and how comfortable they feel with traveling and attending an event. As we know, that's subject to change. People's feelings are constantly evolving, especially whenever the news is always talking about different things going on in different parts of the country. Mm-hmm. But for us, we're very excited to have it in the end of January and use, again, the full suite of services that we'll be talking on and touching on individually throughout this presentation.
Sure. So that jives pretty well with what we received from a response standpoint from the polls then. We have about 50% of responses saying that they will be hosting an event Q1 of 2021, 13% in Q2, and 38% Q3 or later.
Interesting. Okay, so for any of those of you who follow along with frequent industry organization surveys, the last one I heard was, which I think was about a month ago, the majority was Q2, as well as split pretty much equally with Q3, Q4, and onwards, even into 2022. Very few were saying Q1. So it's good to see that, you know, as an industry, we're educating ourselves more and more to see the possibility of how we can have these events sooner. So it's great to see the uptick in those of you who are choosing to have them in Q1. Okay, so here's probably the most interesting part to you. We did have an asymptomatic person test positive who never developed any symptoms at our meeting. So as part of our health risk mitigation plan, once a positive test result was identified, we turned to the data provided by the contact tracing to see who else might be at risk. We set a designated threshold before the meeting. And again, you must do this before, based on CDC guidelines, which bases their public health guidance on an individual who has had close contact within 6 feet for a total of 15 minutes or more. So in an abundance of caution, our thresholds were set for individuals who are around a positively tested person for 10 minutes or more total, with those at 10 minutes or more in a single instance being an even higher concern. The next level we set for close proximity was 8 minutes or more with a 5-minute or more single instance. So we reached out to everyone who fell within these parameters and, following medical professional guidance, advised them to either quarantine for 14 days while monitoring symptoms or to take another COVID test. Following the meeting, no one reported any COVID-related symptoms and there were no other positive cases. So to the earlier question about contact tracing and how to do this, it's great that it is so very automatic. And again, the power lies in the data. So it's, you never want to have a positive person, a positive test, but if you do, you can rest assured that you have all of this data at your hand that you can quickly and efficiently identify those people who might be at risk and contact them before they leave. All right, so now for the results. We conducted a post-event survey, which is highly recommended for most events if you're not doing one already. And we had 75% of the participants respond. So when asked how comfortable they felt with the following, 100% of them listed the pre-event communications, having all functions held outdoors, and the testing. We asked, using all of the same safety measures applied, if they would feel comfortable attending meetings in the following months, and 90% of them said yes. 62% would feel comfortable with 0 to 50 person size meetings, 19% with 51 to 100, and 19% with 100 plus person meetings. So while 86% of people said the contact tracers made them feel most comfortable on site, here's a few things they had to say when asked if they thought they were beneficial. So one said yes, especially since someone was positive. It made it much easier to assess contact and risk. Also, although it seemed annoying at first, the contact tracers offered a great tool to help us maintain social distance. So some context to the last statement is that the contact tracers we utilized were not only for their intended purpose, but they also doubled as a social distance enforcement tool. So each time a wearer came within the predetermined distance of another tag, they would lightly buzz as a notification and provide a flashing light alert until the wearer stepped outside of the permitted proximity. So this could be, this could be anything that you designate before you leave for the meeting, however what distance you set those tracers to be. So there were several lessons learned from this case study, which we have improved upon since. Some of the things to keep in mind with regard to the tracers is if you want to change the configuration of the tracers, say shorten the proximity from 6 feet to 4 feet before the alerts go off, make sure you give yourself plenty of time to do that. The technical updates can take a full day depending on the number of tags you have. Some other feedback that we've improved upon since is the tracers that we've used previously were very robust and they had many different features, most that weren't even utilized, but these were larger, they were heavier, and they had to be hung in a specific place in the chest during the group events. So I'm happy to say that we've now moved on to a better tracer, that it is smaller, lighter. It's probably about half the size of an iPhone. You can put it anywhere on your person. And while it does come with less features, you're only really paying for and using the ones that you need, which is the data tracking, obviously, that uses Bluetooth, but also the social distance piece of it that gives you those notifications and alerts. Okay. So I'm going to pause for a moment to list some additional safety measures I've seen implemented at a number of in-person events I've attended lately. I won't go through each one, but are any of these a surprise to you? Would you like me to elaborate on any you might not have heard of yet? So please enter your response in the chat box. And just let me know.
I'll start with one that already came in, Kelly. And again, feel free, folks on the call, to enter in your responses. But one of them was, and this is personally one of mine, was the podium or microphone sanitation.
Yes, okay, so I've seen this done a couple of times different ways. So obviously with microphones, that is a high touch point. So you wanna make sure first that your staff, your AV staff that's handling them, are wearing masks and gloves, and they're also available to sanitize the microphones between each speaker and each use. So that would include also putting a windsock over the microphone every time. So anytime you change between speakers, you just remove the windsock. And so hopefully all of your speakers are still wearing masks, but you know, they might pull one on you and right when they get up there, take it off. So another way to safeguard against the spread of germs is to have that windsock already over the cover of the microphone, and you just grab that and remove it in between uses. So another one is the podium sanitation. So there are actual spray systems that have been utilized. I saw at North Star as well as with Alhi. They will, after you have two, say you have two podiums and you have speakers kind of trading off in between which one they come up to speak at. And so while they're at one, well, when someone finishes at one and then the speaker starts at a different one, the one that was just finished with, somebody from the staff, the hotel staff, the health team staff, will come by with that sanitation spray and kind of spray down the entire podium area. This is important because a lot of times we think about sanitizing the microphone, but you want to sanitize the podium too, because that's what people are resting on. They're putting their hands on it. That's a high touch point area.
Excellent. Thank you, Kelly. And then the last two are more explanations for the individual bubbles and the color-coded comfortability.
Yes, yes. So the individual bubbles, I'm glad this one came up. I actually have a picture of that here to the right. So this can be taken in a number of ways. When I say individual bubbles, I mean creating an individual space for all of your attendees. So that means every day, you know, if you can, again, based on the design of your event and the objectives, can you assign them a seat? And that is their space every day that they go in. And, you know, this is a very minimal bubble. Really, you can have nice setups with a chair and with their own cocktail table, or with some, you know, a nice plant, or you can add some decor to it, but make sure that they have it would be great if you can feasibly with your budget, have them have their individual space that they know that that's theirs. And so yes, you're sanitizing, but you don't have to worry about people cross-contaminating in terms of going to other people's spaces throughout the day. This also kind of ties into the larger bubbles. So what kind of bubbles are you creating on site at your events? Are you creating areas where the interaction with other guests on property is minimal, with the staff is minimal, with your suppliers is minimal? How are you creating environments where you can really minimize the interactions between people? And so for the color-coded comfortability, I've seen this done in a number of ways. So if anyone has seen it online, it's basically where you can have a red, green, or yellow colored lanyard or wristband. Green, I'm open for hugs, you know, very comfortable with touching. Yellow, I'm okay with interaction, but I'd like to keep touching to a minimum. Or red, I'm really not open to interacting with people, please give me my space. And so again, these are things that are communicated in advance, so everyone's aware of them, everyone can choose what they're comfortable with. But again, I've seen these utilized at places, but my biggest hesitation here is we don't want anyone to feel uncomfortable with how they're perceived. So I know a lot of times people can be judgmental, as we know, and so it's hard if you attend an event and you have a very open mindset, but maybe you're judgmental of those that don't. And so is that going to change the dynamic between you and that person in any way, just because you now know how they feel and how they feel about the virus? So I mean, I think it's still definitely doable, but something to consider, again, based on your audience and who's going to be the attendees and how they interact with one another. Is it people that know each other very well, or are they all complete strangers? So great, I'm glad though some of these were surprise to people, and I could help explain it a bit more. Okay, so for our next case study we had all of the same safety standard protocols mentioned prior that we did for the Minnesota meeting. It was a similar level and breakdown of attendees again, but because of the region, different people opted to attend this meeting versus the other. It was held at the Ritz-Carlton Lake Oconee, which was another beautiful and expansive property. Again, there was a similar schedule with a change in the optional team building activity. So for this one, they chose to do laser skeet shooting. So here are some pictures of the setups for the dinner above and the meeting below, how the bar looked in the top right corner, and then how people were networking. Plus, a few of them show the 6-foot tables, one of the 6-foot tables that was utilized during where the testing was done. And then you can see the team building in the bottom right corner. You can't really tell by the picture with the angle, but those each person was probably 3 to 4 feet apart, and we did sanitize those guns in between each use, as well as provided sanitizer to each individual person. Okay, so for the results from this survey, we had 69% of people respond. When asked which safety measures taken on site made them feel the safest, the top leaders were social distancing, mask wearing, and testing. 86% felt safer with the testing than if it wasn't available, and 68% felt the same about the contact tracing. Surprisingly, with this group, 86% of them were willing to fly cross country, which is contrary to many of the industry survey results we're seeing, saying the majority of people prefer to drive to smaller regional events. Now, it could be just this group, which is again to the point why I'm trying to stress it's so important to know who your audience is. Some people are going to feel only comfortable driving to smaller regional events, but with this group, they're open to those flying cross country. So to that point, yes, about a third of these attendees felt safe with 0 to 50 person size meetings, but a third also felt comfortable with 51 to 100 person meetings, and slightly more than a third were comfortable with 100+ person meetings utilizing all of the same safety measures. So for our final case study, we had a unique challenge. A separate company division wanted to hold a sales training near where the executive summit would be at the Ritz-Carlton Lake Oconee. The problem was their budget was drastically different, and if you've ever been to the Ritz, you'll know not only are they budget friendly, but it's in an extremely rural location, and there isn't much else around it. So our mission was to find another property that fit within their budget, was no more than 30 minutes from the other hotel, and had outdoor meeting space to fit their needs. Mission accomplished. It was a tough find, but they held their event at the James Madison Inn. So you can see this group was younger in scope, and they had a smaller group total. The schedule again shows some key similarities to the others, but there were some differences since we had slight overlap with the executive group. The sales staff arrived at the hotel and were shuttled to the Ritz for a combined dinner, which was actually the executives' farewell dinner. The next day was a full day meeting with the casual group meals, and then departures followed the day after. So here are the pictures shown of some of the meeting and the participants. The one in the top left is a participant with the rapid antigen test. So we did rapid antigen and PCR at this particular event. So it also shows how we had to be very creative with the outdoor meeting space. I say that because even though we found the James Madison Inn to suit their needs, the new challenge was there was no banquet teams and we had to bring in everything ourselves besides the table and chairs. We rented the linens and purchased individually wrapped food and beverage items. In the morning, we were able to have 4 attendees who couldn't be in person at the meeting join online with their own dedicated call-in. You can see in the top right picture, we had each of them showcased on an individual laptop so they could listen to the presenter and ask questions directly. So 57% of participants responded to this post-event survey. And again, the reigning measures that made people feel the safest were social distancing, mask wearing, and the testing. 100% of them felt safer with the testing than if it wasn't available, and 75% of them felt the same about the contact tracing. Another surprise was similar results on travel. We had 88% feel comfortable with flying cross country. So you can see that's kind of a recurring theme with this company. So a slight shift in what we were seeing with the executive group though. 50% of them were comfortable attending 100+ person meetings, now using all of the same safety measures. And then still 0% of the people reporting any COVID-related symptoms or any positive cases. And 63% of people said they would likely only attend a meeting if it had testing available. So I combined some of the lessons learned from these 2 case studies and to rethink your setups. So knowing what I know now, I would have meeting and dinner setups as 6-foot tables with people at either end. This is the only way to truly have 6 feet of space between the attendees. Again, I've done this as well as attended so many events that have done this, but with the banquet rounds, their original intent was to fill as much seating as possible in a space, right? But now they take up more space than needed, and you only have 2 to 3 people at each. So even still, there's only 2 to 3 feet of space between people when you do that. And if this is at a meal function, that means people have their masks down for longer than 15 minutes, as recommended by the CDC, and they're within 6 feet of one another. So definitely would keep that in mind for future setups. Also, even when we set the bar in an open area at the end of a building, that was a little more limited in space, but we stretched the cocktail tables wrapping around there all the way through the side of the building to show the ample space available for social distancing. But human nature took over, and so everyone's still congregated right around the bar in that more condensed area instead of spreading out. So that really is going to happen unless you have somebody who's available to monitor and police the area. So as much as you're able to fight against human nature, put the bar in an open area like a lawn, so if people default to staying next to it, there's still room for social distancing as much as possible in the same space. Some additional feedback that we heard from both groups was resounding, is that they wanted to be tested at least twice. So whether it be before they left and once while they were on site, or 2 times while they were on site, beginning and end, they said that would make them feel safer. Okay, so before we get into the solutions that we used, it's time for another polling question.
Great, thanks, Kelly. And this one, again, I'm very interested to see the responses. The poll question that you'll see on your screen is, have you been asked to look into or provide on-site testing options? Considering I think that we've all had to kind of take on some additional hats, ones that we never anticipated doing. Again, I'm curious to see these answers, but you can select one from below. Yes for events that are occurring now, yes for events that are in the future, and maybe you haven't been asked yet, but you anticipate that you'll be asked. And then the last being no, and I don't foresee being asked. So I'll go ahead and leave this open for about 30 seconds, and then we can discuss those results. Okay, and so Kelly, it looks like 50% of respondents said yes, they've been asked to look into on-site testing solutions for events in the future, and then a 25-25 split between the no's of being asked with anticipation or not being asked.
Okay, good to know, good to know. So hopefully for those who are actively searching this, we'll shed some light on some available options. And for those who haven't been tasked with that yet, but maybe it's good to have in your back pocket, right? Again, with the U.S. Travel Association putting out those articles and the webinars on how testing is being more frequently utilized within the events world, it's always good to kind of be at the forefront and have that knowledge before you are asked by your stakeholders. So with that, we took the Safer at Work suite of services that provides comprehensive testing strategies and practical implementation approaches critical to reducing the impact of COVID-19 on businesses, and adapted it to the meeting and events world. We used a 4-step process when planning for our events. We started with designing the protocol based on the scope of the event, discussing which services would be most impactful for the group, factoring in our budget and the desired frequency of testing, and finishing with a full logistical plan of how it would be implemented. So, and after that point, you're able to offer the attendees the test based on what we had outlined. We all know that no 2 events are exactly alike, and each are unique in their own way. So for that reason, it's important to know that the testing approach can be just as unique and customizable to the specific needs of the event. One of the most important steps for consideration is, how are you going to act on your health risk mitigation plan if needed? How are you communicating results? What are you going to do if you do have a positive test result? And what type of contact tracing are you using, if any at all? Now, again, whether you utilize testing or not, or contact tracing or not, this should be part of all of your plans and in any of the pandemic meetings that you are having. So, okay, so another option that we didn't use for these case studies, but we will at that 120 person event that we're holding in January I mentioned before, is having an auditor pre-check the facility. So the pre-check includes surface testing of high touch point areas within the property for the virus and conducting a full risk assessment of the venue's safety standards to identify opportunities of closing the gap where risk is identified. There are 3 options we use for testing solutions that are all distinctive in their own way. So the first option is where you ship all kits in bulk to a single location, conduct all the testing, and return all the samples back in bulk to the lab. This is what we used at the 3 case studies that were shown in this presentation. Now, again, depending on your event, you could use either one of these, which is why it's good to evaluate your program, look at the agenda, look at the objectives, and then determine which answer is best for you. So the second option is to ship all kits in bulk to a single location. The individuals pick up the test, take them on their own, and return the sample back individually to the lab. The final option is where a person is sent an individual test, they take it on their own, and they return the sample back individually to the lab. You can see each option comes with specific pricing that varies on whether the testing kits are prepaid or invoiced. All of these prices are based on a 100 kit minimum scenario, but can change depending on the number of kits needed per event. So the larger the volume, the greater the consideration for potential discounts. So these are the problems that we're facing. You know, staff and attendees are fearful to gather, but there are solutions to provide quick and efficient testing to participants to give everyone greater peace of mind before even starting the journey and while on site. You know, social distancing compliance is difficult to regulate. You know, we've seen this, we've felt this. It's the human nature aspect again. If networking and socializing is an important part of company culture, the certainty that comes with testing can allow attendees the ability to be slightly more relaxed with social distancing while in their on-site bubble. And of course, organizations are burdened with providing safer environments. So deliver on those promises to your clients, to your stakeholders by supplementing your existing safety protocols with testing solutions, instilling greater confidence in all of your stakeholders. So why Eurofins? Good question. We are, you know, one of the biggest companies that no one's heard of. So we're an international life sciences company and a world leader in clinical diagnostics, forensic, pharmaceutical, food, environmental, and agri-science laboratory testing. We have 800 laboratories in 60 countries, employing 45,000 employees collectively. We've been around for 30 years, and it's our commitment to support the fight against the pandemic. So before we go, I have one last bit, or get to Q&A, I should say. I have one last bit of information to help you in your planning during these concerning COVID times. So here are some steps to consider as you build out your planning. Before you contract with any property, make sure you have a full understanding of the property and venue sanitation efforts. What are they doing? How often are they evaluating and improving upon their process for enhanced safety? Is this something that they've done, you know, one and done, or are they constantly trying to evaluate this? Site inspections are crucial. So I know, so there is a travel ban for some of y'all, and that's okay. These can be done virtually too with a variety of online tools now. But when you're doing them, whether they be in person or online, make sure you see at a minimum the floor plans and diagrams for how the socially distant setups are that they're offering are going to be placed. And build more time into your timelines. Things are taking longer, and that's because there are fewer resources available. We know all too well the amount of people in this industry who have been furloughed or let go. So that's hitting us all, and so make sure that you're keeping that in mind as you build out your timelines. They're going to be longer than your traditional planning timeline. So analyze your areas of risk. You can do this with a consultant or alone, but definitely analyze each risk, prioritize it. So line itemed out what each of those risks, prioritize them, and set what your trigger would be for each. That means it's time to implement your response to each item. So you're building this all out so you know specifically whenever a trigger happens, you're ready to implement that response. So be your biggest challenger. I say this as in negatively brainstorm. So when you're analyzing your risk, consider all of the worst case scenario situations, the things that you aren't aware about that could be crippling, and don't let them blindside you. So try and always take the devil's advocate approach so that you're really getting the full picture of the risk that could affect your event. Build out your protocols. Design might feel differently these days, but it is still based around intentionality, and now safety is the top priority. So design with all of those risks in mind and try to mitigate as much as you can through that. So establish a code of conduct. Just as much as you are doing everything you can to provide a safe environment, the attendees need to be aware of the base standards they are expected to uphold individually. So that would be things like socially distancing, wearing a mask, hand washing and sanitizing frequently, and having them be empowered to report when someone is blatantly choosing not to follow the same that is asked of others. So you want to use this code of conduct to establish an environment for those that are going to be interacting with one another over the course of the single day or the multi-day event that you're holding. So check stakeholder buy-in. Check with all of your stakeholders. So that means executives, your attendees, your clients, your suppliers, and get their perspectives on the protocols. Is there something that you're missing? What if they have their own health risk mitigation plan or code of conduct? How can you collaborate to make sure that you're not missing anything? And of course, we're trying to get a sense of how reasonable do all of these requirements seem to everyone? Is it feasible, or are we asking for things that are incredibly outlandish for the specific group that we're catering to? And create a duty of care. So duty of care is a term that many toss around, but is often not well understood. The definition of duty of care is a company's obligation to protect its employees, travelers, and meeting participants from risk. These risks can be related to injury, sickness, safety, security, health, or travel. So many different organizations, particularly in the hospitality world, already had duty of cares, but now they're becoming more prominent because people want to understand, what is your duty of care to me as an attendee with relation specifically to the virus? So that's being included in the duty of cares now to show what steps are being taken to guard that safety, in addition to everything else that they've always been looking out for. So MPI has a wonderful duty of care you can review as an example that they recently did for WEC. And for those of you who attended like myself, you were able to experience that firsthand. So next is a solid contingency plan. How confident are you with your responses that you outlined to your risk analysis? Your plan should account for as many viable scenarios as possible and how prepared you are to handle them. Again, you don't want to, go insane thinking about every possible little thing that could probably occur. Just in that risk analysis, put things that are most likely to occur, that have a high chance of occurring, and make sure that you're ready to prepare for those. You're ready and prepared for those. So over-communicate your expectations and do it early. Now that you have all of your research, your assessments, and your design plan, communicate those expectations to all of the attendees. Do this early and frequently. It's also a good idea to be surveying the attendees multiple times leading up to an event to gauge their feelings towards traveling and attending live events. So for example, the one that we're having, the event that we're having in January, we will be surveying everybody at least twice, if not 3 times. So at least once a month leading up to the event to see what their sentiment is towards traveling and attending live events. This also helps you get a better understanding of what your room count is. So obviously, I'm not going to get into contracting, that's a whole other subject, but attrition's a big part of that, and you want to make sure that you have a pretty decent idea on the rooms that you're going to be needing and building that into your attrition, so you're not going to be penalized for a big drop off in people that are suddenly not going to attend. Okay, so prepare your on-site teams. So just as much as you communicate early and often with your attendees, you need to do that with the staff to equally prepare them for what is expected. So this could include training them. This includes training them regularly, even daily during events. So what that looks like is making sure that they understand how they are an extension of you in providing service to all of the attendees. You want to make sure they understand the expectations, that they know how to use PPE correctly, They know how to wear the mask properly. You want to make sure that the daily trainings could be where you're gathering feedback throughout the day individually, and then you're all getting together to go over that feedback and using it to implement and change and improve your processes right then and there versus trying to gather all of this info post-event. So, and lastly, have a growth mindset. So nobody is an expert at this. Mistakes are going to happen. And in a lot of times, what we used to think of as success is not going to be the same anymore. Maybe success is going to be walking away from an event and having everybody having no symptoms and no reported cases. You know, maybe it's having some people connect that haven't been, you know, out of their house in 9 months. You know, it's going to look differently. So, you know, be open to changing your objectives, be open to feedback and learning and improvement from each experience, and again, improve upon those for every time that you have a new event. All right, so let's open it up for some Q&A. Actually, I'm sorry, I think
You're fine, Kelly. We just have that one last poll question, which isn't a poll question. We just want to make sure it's easy for you to connect with us if you would like to learn more. So if you would like a Eurofins team member to reach out to you regarding some of the services we've discussed in this webinar or some of our experiences, you know, please select the appropriate answer, and we'll follow up with contact information as well if that's easier for you too. So I'll leave that open just for a few seconds. And once you're done with that, feel free to start inputting your questions in the question box, and we'll go through those here in about 30 seconds.
Okay. Now for the Q&A session, and in case any of you weren't able to respond to the poll quickly, but you would like to reach out, there's my contact information. So please feel free to email me with any questions you have, or you're just bouncing ideas off one another. I think I want to be available for you, and you can also connect with me on LinkedIn. So with that said, let's get into some Q&A. Jessica?
Yes, of course. So let's start with the first one here. And these are really great questions, so thank you and keep them coming. One of the first questions is, can you elaborate more on what the testing setup looks like on site?
Yes. So like I said, it does depend on the specifications of your event. Is this a 5,000 person event? While we're not doing those now, maybe you're planning that in Q2. Versus some of the smaller events that we've had and that have been demonstrated in this the case studies. So with the smaller ones, for the 100, 150 person, I think you can get by with 2 6-foot tables with 4 internal staff to do this. And this also depends on whether your attendees are all coming at one time, whether it's going to be staggered. So these are the types of things that you want to consider, and we'll talk through when you're evaluating your testing approach. But if you don't have the internal staff to do this, or if you just want to, you want to make it a thing that you don't even deal with and you have someone else handle it entirely, we actually partner with ITA Group to set up, operate, and tear down the testing site for you. If you're looking to, partner with somebody to come and take care of all of that for you as an extension of your team.
Wonderful. Thanks, Kelly. The next one is, where would you find the auditor for those verified event services?
So where you find the auditor. So that would be just a service that we provide. And if you indicate any kind of type of interest, we have certified auditors all throughout the country. So we would basically, depending on availability and time of event and location, we would have one of those come out and then provide, again, the pre-checks that they do and the surface testing, as well as evaluating the hotel's protocols and whether there's any gaps where risk potentially identified, and give them the opportunity to mitigate that risk. And then once they reevaluate and see that everything is up to code and has been audited, then they'll receive that verified seal. And so that verified seal is really great because it is a physical, it is a sign of confidence that you can see, and you can use that in your pre-communications with people. So leading up to the event, as we said, communications are so important to have frequently and early and honestly. You want to be very transparent and be transparent in saying, this is what we've done, this is what we're doing, this is what you can expect. So having that feel is nice because you can say, here's what we're already implementing before you even get there to take your safety to the next level and keep it at top of mind.
Thank you, Kelly. The next one has to do with the contact tracing. So do we have to use those contact tracing devices for events?
So no, great question. No, you don't. But they are an excellent tool to take, again, safety, a full approach to the considerations for that. So the devices make it easy to stay on top of who has interacted with who, how many times, and for how long. So if you do have a positive case, you can easily track those potentially at risk. This is a much more automated process than if you were to try to do contact tracing relying on phone numbers and people trying to make a list of who they interacted with up to 2 days prior to testing positive or developing the symptoms. But again, it's not required. And I think if you're going to go the route of not using contact tracing, then I would advise to implement testing at least twice. So whether that be before they leave for the event and while they're on site, and that way you get the results within the 24 to 48 hour time frame from when the samples are received at the lab. So you're still catching people before they leave. You can do that. So you could either do the testing before, testing once on site, or if it's a longer event, you can do testing twice on site at the beginning and at the end before they depart.
Perfect. Thank you. And I think we'll have the last one. And again, if your question wasn't answered here, we will follow up with you via email personally to get you those answers. But for the last question, Kelly, it's regarding those rapid antigen tests. Can you tell us the I guess, practicality and how beneficial they are? There's been a lot of word in the news about their inaccuracies. Can you elaborate more on that?
Yes, so the most common form of the rapid test that you're hearing is the antigen test. And so people are most interested in those because you're able to do them on site and you get your results within 15 minutes. So that's nicer. While 24 to 48 hours from getting a gold standard lab result is the best in the industry, with many times that result being within the 24-hour time frame. It's definitely not as fast as 15 minutes. And we know how people want to know things, instant gratification. So that's probably the #1 reason that they're used most frequently. So they're able to confirm with a degree of accuracy if you're symptomatic. And so if you're symptomatic and you have a high viral load, then they're going to catch that positive test result. But they can miss a percentage of those that are asymptomatic. So not saying that they miss all of them entirely, but there's a chance that you could have somebody who's asymptomatic that tests negative on that particular device. So that's pretty much industry wide, but it's an effective tool to pair with the PCR test done in advance. So this is good, especially if you have people who are exhibiting symptoms. So for example, you could do it where you test people before they leave their homes, and then the day of arrival, you have this paired with the rapid testing. So you're doing your daily temperature checks, your thermal screening, and if you have somebody who is running a fever or displaying some types of symptoms, or who commented that they do have symptoms on their daily health questionnaire, then at that point you can do the rapid test to test as the second measure after you've already tested them once.
Excellent. Thank you, Kelly. With that, we'll go ahead and close the webinar. Again, I want to thank you, Kelly, for an excellent presentation. I want to thank all of our attendees for taking the time out of their day to attend and engage with us. As a reminder, the recording and the slides will be sent to you within 3 business days via email. We will return the remaining questions that need answered via email as well. Kelly's contact information, as well as a Safe at Work team and website information, is here for you to view in the meantime if you would like. And again, we look forward to getting back in person and collaborating with y'all to get there together. So have a great weekend, and thank you again.
Thank you.